With our hospitals at or near capacity, medical professionals are working more than ever before. Many are experiencing a burnout issue that's driving some of them out of the industry. In today's Hello Idaho, we take a look at what's happening right now in Oregon healthcare facilities as the fallout from the pandemic threatens to decimate our frontline medical workers. Mark Johnson has the story.
Oregon's healthcare system has been broken for a long time. Our pleas for changes to make the system patient-centered have been ignored by hospital executives for decades.
Matt Calzaya is a registered nurse and a practice consultant with the Oregon Nurses Association, or ONA. He and his colleagues say long-standing staffing issues are exacerbated by the pandemic.
The despair on the nurses' faces and the fatigue, it's more profound than I've ever seen that.
And the burnout is real.
85% of the nurses at OHSU have indicated that they are unable to use vacation time or take a mental health day because there are not enough nurses.
But perhaps the most concerning stat, Calzaya says 60% of the state nurses are considering leaving the profession entirely. He says that percentage is reflected everywhere, including Idaho.
Losing even a single nurse from the bedside will result in greater strain.
While Linda Pond, ONA president, says more than 90% of ONA nurses are fully vaccinated, recently healthcare systems have put thousands of staff across the country on leave because they refuse to get the vaccine.
As we see some small number of nurses potentially leaving the profession due to their decision to decline vaccination, we are also concerned that burnout will lead to an even larger number of nurses leaving the bedside.
Natasha Schwartz, a registered nurse, says the bottom line, the staffing crisis, needs fixing, especially as the pandemic stretches an already stretched system.
It's just compounding the work day after day after day, compounding the trauma. That's what the moral injury is that we speak of. That is what is driving nurses away from the profession that they chose and the profession that we love.
We've done a number of stories this year about the shortage of nurses in Idaho. The Idaho Department of Health and Welfare website has a page dedicated to providing mental health assistance for stressed out medical frontline workers. The hotline number is active 24 hours a day, 7 days a week. The number is 866-536-0239. Crisis counselors are there to help with any and all mental health issues from frontline medical professionals that they may be struggling with right now.